Okay, so I'm Rob Daniels, I'm a GP in Seaton and I'm a senior lecturer at the university. One of the things we wanted to do was try and get a work experience week so that all of the students in the state schools that we're really aware of have got the potential to follow careers like medicine, who don't currently get any opportunities to get involved in that, would come along, learn a bit more about medicine and spend a week in one of the practices in East Devon where they're able to get a better idea of what's involved in the career and hopefully some advice on how to follow that career if they decide it's the thing for them.
I'm Tina Teague and I'm Chief Executive of East Devon Health. It's a GP federation with 13 practices covering all of East Devon. We serve 123,000 patients, and I've been working with Rob on the idea of trying to mobilise the placement programme. So Rob, tell me a bit about what you're trying to achieve with because I remember when you first mentioned it to me, the kind of concept and what you were trying to achieve from that.
So what we're hoping to do is try and get people the opportunity to come and actually see what really goes on in GP practices, how the whole primary healthcare team works, multidisciplinary teams, pharmacists, nurses all working together, and realise that just how many careers there are in the NHS and that it's not something for private school educated rich kids, it's for everyone really, and more than anything to access the potential in the state schools that we know is there.
Okay, and do you want to just say how the week is going to run for the students?
So today's all about lectures, so we've got a number of speakers in about life as a GP, as a medical student, junior doctor, how to get into medical school and different careers in medicine and outside medicine such as pharmacy. The rest of the week the students are going to spend in GP practices all around East Devon, and as part of that we're hoping they'll do some research as well to give them something understanding of what goes on in medicine and also to help them get some experience that might be useful in applying.
And we've had a good quality of applicants and we've actually had to turn some away because we were oversubscribed. Any thoughts on futures for the programme?
I mean, one of the plans is to try and expand it a bit so we combine with Exeter Primary Care or other practices in the wider area so that we can get students from Exeter and elsewhere also getting access to this. And for us it's really important to get the students together so they can learn from each other as well.
Great, thank you Rob, thanks.
Hi, Sunita.
Hi there.
Welcome to our GCSE program. Tell me, why did you apply for the program?
Well, I know that I want to go into medicine. I want to apply to medical school, but I really wanted to get some experience, because as a patient, we go into a GP surgery, you think, okay, I'm going to see the doctor and that's it. But there's actually so much behind the scenes, what a doctor does, their roles, how different roles in the surgery work. So I kind of want to get some experience on how that works.
Great, yeah. And how did you find the process of applying?
Oh, it was wonderful. It was wonderful. Everything was organized. If I needed help with anything, I could email everybody. They were also helpful, very organized, so I'd recommend it, yeah.
Great. Tell me why you want to become a GP. Where's the passion come from?
Well, I've always loved science, all types of science, but I also enjoy working with people. I could not bear working in an office job. So I thought, what profession combines science and working with all different types of people and helping them? And that's where a GP or any hospital profession comes in.
Great. Lastly, what are you looking forward to most for your 4 days of your placement in the surgery?
I think just working with and observing different types of GPs and what they do on a day-to-day basis.
Okay.
Yeah.
Lovely.
Thank you. Thank you so much.
Okay. Hello, so my name's Tori. I'm currently a third year medical student. Well, I've just finished my third year of medical school, so I'll be going into my fourth year of medicine in September. So I'm going to talk a bit about kind of life as a medical student. So I got into medical school, well, I finished my A-levels in 2014, and then I applied for medicine and had an offer from Birmingham University, and they wanted an A-star and 2 A's. Unfortunately, I didn't get the A-star, so I got 3 A's, so they didn't accept me. So I decided to take a year out, and I thought, you know, I'll apply for a healthcare assistant job in my year out. So I did a gap year. And I worked as a healthcare assistant in trauma and orthopaedics, which was an absolutely amazing experience. You know, I learned so much from working with patients, helping them with their personal care, and it's helped me so much in my medical degree.
Right. Hi, Elliot.
Hi.
Hi. Tell me, what did you think of today?
I was really impressed by the kind of the array of talks that were held. I felt like I've been able to take quite a lot away that I wasn't aware of before.
Yeah.
And I'd got an idea specifically of kind of general practice in my head, but I've been surprised by the kind of variety of areas that you can go and specialise in with the research and some of the different ideas that the people spoke about.
Yeah. Has it put you off at all going to medical school, because there was quite a mixture there? You still keen?
Yeah, definitely. The more I find out about medical school and kind of beyond medical school, the more that I do think kind of it's the right decision for me. But I think it was important that there were people kind of different stages of their career.
Yeah.
So obviously you got the GP trainee,
Yes.
so only part of the medical school as well.
Yeah.
So that was really useful to get insights from different people.
Yeah. And the section about how to apply and doing your application,
Yeah.
is that helpful as well?
Yeah, I feel like we are given a lot more information now, particularly at my college, but anything that we can pick up I think is important, especially kind of with competition nowadays.
Yeah.
But no, I thought, I think was it Crawford?
Yeah.
He was kind of very useful in terms of what I could pick up from that.
Great. Lovely. Thanks, Elliot, and
Yeah.
we hope you've enjoyed today. It sounds like you did.
Thank you very
you.
much. Thank you.